That's right, and travel restrictions put in place are affecting not just passengers, but the airlines. A number of airlines having announced that they're cutting off flights, and just in the last few hours, the Air China desk behind me, it's closed. It's been closed because the daily flight to Beijing has been canceled. A local agent for the airline confirming that all of its inbound and outbound flights will now be canceled at least through the end of this month. We've also heard that the U.S. health officials, the CDC, are insisting that the restrictions that they are putting in place, the restrictions that are upsetting some, are good and necessary. The U.S. Centers for Disease Control, the CDC, on Monday confirmed that passengers traveling from China will now be funneled through 11 U.S. airports, best equipped to screen passengers for the novel coronavirus. That's up from 7 airports. According to new restrictions put in place over the weekend, Chinese travelers originating in the People's Republic, even those connecting through a third country, would be denied entry to the U.S. Meanwhile, American health officials say they are working with local authorities to decide where individuals who might be infected will be quarantined. They say no option is off the table. They also say the U.S. is working on possibly evacuating more American nationals out of Hubei province. Across the Atlantic, at an executive meeting of the World Health Organization in Geneva, China condemned what it said were excessive restrictions imposed by a number of countries, including visa rejections and denying entry to persons with Hubei-issued passports.
The World Health Organization's temporary recommendations do not recommend any travel and trade restrictions. We are all in this together. It concerns every country and everyone in this world.
The head of the WHO echoed the sentiments, while commending China on the steps it's taken to prevent the spread beyond its borders.
If it weren't for China's efforts, the number of cases outside China would have been very much higher. And it could still be, but we have the opportunity now to work aggressively to prevent that from happening.
On one hand, it seems intuitive: shut down the border, things will spread less. But it has all sorts of other effects that you might not want. For example, preventing the movement of supplies across borders. So I'm one of the majority of people who do not know whether the travel ban is the best way to go. Happily, I'm not the person who has to make that decision.
Roy, what are you hearing from the travelers
And the World Health Organization? Well, some of the people here have been telling us, we saw one family show up here, a Chinese student and also her parents who are visiting from Shanghai, showing up 8 hours early for their flight, not trying to get on the plane, but trying to get off the plane. She wants her parents to stay here longer. But in general, the situation here is quite calm. I saw a few people walking around with masks, but for the most part, if you weren't looking for it, this would seem like just a typical day at Dulles Airport. Mike?